Hi there, this is Mark Ittleman, speech-language pathologist, author of Teaching of Talking, and here is another video about a subject many of you have an interest in, and that is the caregiver learning how to stimulate speech and language. You know, it's so important. I just have to go on and on and on and on and share with people around the world how important it is for a caregiver to learn how to stimulate speech and language, because of the fact that speech therapy in these days and times is only going to be given for a certain amount of visits, and then it's going to end, and then people are going to be left holding the bag. You know, when I grew up, there was a great commercial on TV, and it was, I think it was Bumblebee Tuna or something like that, and it had a picture of Charlie the Tuna, and Charlie the Tuna had something to say in this commercial, and it was something to the effect is that all there is? Sorry, Charlie. You know, sorry, Charlie. And you know, we all hate that, don't we? When somebody is giving us something, or we're getting services, and all of a sudden it stops, and people say to us, well, sorry, Charlie, or sorry, you've reached your maximum, or something like that, or you've reached a plateau, or any number of other things. And this can be very, very disheartening. It can be very disheartening to the caregiver. It can be very disheartening to the patient, because they realize at this time that therapy is no longer going to be paid for. And let's face it, speech therapy is an expensive proposition, and most people don't really have the money to pay for speech therapy that's going to be going on long term. And so this particular video is about a patient I'm seeing right now, and this patient is from India, and she doesn't speak any English at all, and she's in her late 70s, and she had a stroke. Well, she has a daughter-in-law, and this daughter-in-law is very, very dedicated to her, and the patient came in for an evaluation earlier this week, and the daughter-in-law observed me as I worked with the patient and helped me. First of all, she told me what the vowels were in her native language. So therefore, what I wanted to do, since she had an aphasia and an apraxia, is I wanted to test her stimulability, or how well she could imitate the vowels of her language. And see, this is why it's so great to work with caregivers, because in America today, let's face it, America is changing, and we're having all kinds of great people coming to America. We're having Mexicans, we're having Indians, we're having Israelis, we're having Persians, we're having everybody coming. And it's great because it's making America terrific. There's great new restaurants, there's great new cultures to learn about, and that's what makes America so great, right? So anyway, the caregiver of this lady, who was the daughter-in-law, told me what vowels were in her native tongue, and therefore I went about assessing whether or not she could produce these vowels. Well, she could only produce like about 2 out of the 8 initially, but by the end of the visit, it was really interesting that the patient was able to produce about 6 or 7 out of the 8. And you know, this daughter-in-law was very, very proactive. I mean, she worked right there with me. I taught her about placement of articulation, and how if a person is having difficulty producing sounds, what you have to do is you have to put the articulators in the position. So in other words, if I want to teach you how to say ooh, I don't just say ooh, say ooh, say ooh. No, what we do is we show the patient the placement. And before we even work on the sound, we see if the patient can produce the placement. And then we taught the patient how to say ah. But we couldn't just say ah, because that didn't work at all. What we had to do is we had to have her open her mouth like this. That's the position for the ah. So I taught this this daughter-in-law that we're going to improve her apraxia of speech, but what we have to do when we cover the vowels is we have to make sure that the patient can put her mouth and her tongue in the right position first before saying the sound. Well, today was the second visit. She was able to do all of the vowels, the patient was, plus she was able to say yes and no in her native tongue, and this was only the second visit. It was because there's an old principle in articulation therapy called placement. And for many patients who can't imitate particular sounds, all that means is that you have to go to a simpler level, teach the patient how to put their mouth in the position for that vowel, ah, oo, o, a, e. So what you have to do is you just have to get them into the placement of the sound before you start making the sound. Well, this daughter-in-law is going to make an excellent speech therapist for her mother-in-law. And she's very proactive, very motivated, and we've been making headway unbelievably in a very short time because this caregiver is so interested and motivated and loving towards her mother-in-law. Now, I know there's lots of you caregivers out there, and many of you feel like you don't have what it takes to help your loved one speak better, but you do, and you can. And you can learn in the Teaching of Talking, our book, how to stimulate speech or how to stimulate language, how to stimulate words, and you can do that. And in many cases you can. Now there are some who you may not be able to, but the majority of people you can make improvements in their speaking if they're motivated and if you learn the proper methods. If you have difficulty with any aspect of stimulating speech or language, just know that you can contact me, Mark Ittleman, at teachingoftalking.com, and I can help you out on this. I cannot tell you how much a person can progress if they have a caregiver or a loved one or a speech pathologist who is willing to learn some of the fine nuances of stimulating speech and language that have taken me over 40 years to learn and to integrate. Okay? So on that, I'd like to thank you for stopping by. This video is for caregivers, and it's about how wonderful they are and how important they are and how vital they are to help an individual speak better. Please, I know there are many of you wives out there and many of you husbands out there who are afraid or uncertain or don't think you can, but you can help your loved one speak better. Don't give up on that. Just learn, and learn with the Teaching of Talking. And if you have any difficulty, again, contact me, Mark Ittleman, at teachingoftalking.com. And on that, I hope that you'll stop by our website and become our friend at Facebook, Teaching of Talking, and our website, of course, is www.teachingoftalking.com. I wish for you a great day today. I wish for you a great month. I wish for you a great year. And of course, I wish for you a great lifetime. Bye-bye now.